Yep.
All right. So how do you guys place sealants? What's your protocol? How often you do it, and then we'll kind of get into if you think sealants are effective, because that's a big debate too. So you go ahead, Andrew. I see you smiling.
Well, just the whole debate part. We'll get into that a little bit later.
Mhm.
For me, the sealants, I don't have to place very many. Um, and we just do the high evac. I usually have an assistant that'll help with that. They'll place it right behind wherever I'm working on, etch it. I don't bond in my sealants. I know some people have bond in their things. We use the sealant material that's just a little bit more moisture friendly. But for me personally, I still like to see that nice chalky ring wherever the etch was. Place the sealant and cure it. It's very simple. We'll do the dry aids and I'll do cotton rolls and I like to be the person that holds down the tongue because the tongue is kind of a squirrely little thing and I like to be the person in charge of that one.
Mhm.
Yeah,
Trish? Yeah.
and I don't really use any type of high speed. I usually do sealants solo, and I do quite a bit of sealants though because we have a family practice where parents actually come in with their children. We even do sealants on adults a lot of the times. What I find is first and foremost the most important is prepping the tooth either with an ultrasonic or the ProfiJet or both. It depends on how gunky their grooves are, but that is what helps me with retention the most is getting those grooves super clean, and sometimes even if a little bit of enamel comes off, we don't call that a fissurotomy, but
I hear
it helps retention. So, but I'm just cavitroning to clean it out. So anyway, and I use the Neo Dries, which I believe that Mark, you've reviewed those and you recommend them. They are fantastic. I've been using them probably almost 10 years now. It's a triangle that's like a diaper. Basically, it fills up. It has a gel in it that fills up with the saliva, and it stays in place. And then it's slick on the other side. And then I get my little fingers and hold them down with the 2 cotton rolls on either side. I'll switch, so I need 4 cotton rolls per side of the mouth, and I just switch out the cotton rolls once I've done the etchant, and then go with the ClinPro. We've been using ClinPro sealant for about 10 years too, and because we just really haven't found anything that's comparable except for the UltraSeal Hydro, and I use that one. We got a sample. I haven't actually purchased any more. About a year ago, and I'll use that when I still have enough that on the tricky patients, instead of having to bring an assistant in to help me, I just go for the hydro, and it's like, you know what, we don't have to worry about dry field at this point as long as there's no saliva, getting down in the groove. But that really seems to make the difference is number one, prepping the teeth, and then just using the right sealant for the situation.
Daniel?
I believe I use the Ultradent. I can't recall off the top of my head because I don't use it that often. Um, when I do, I typically find like just a few weeks ago, I had a patient who was going through chemotherapy, and he usually good hygiene, but his teeth were on the decline, caries everywhere, like very new ones, and so I just stopped off schedule for a second and sealed all of his teeth in one shot. As far as method, I mean standard, I usually abrade with the air polisher, um, etch until it's really chalky. I don't use a bond, but with some brands I do, and just pretty much standard sink. But I do use the isolite for it because I think it's just too convenient not to. It gets the tongue out of the way, keeps it nice and dry, and I don't have to worry about anything.
Yeah, my protocol is I use the isolate. I'm currently testing. I don't know if you guys saw my video. I'm testing the Isolate's competitor, the Dry Shield. It's an autoclavable mouthpiece. That works pretty well too. It's the same concept basically. So I use that, and I micro etch sometimes. Depends how filthy the tooth is. But I use pretty much anything. I use perio tips. I use thin sickle scaler. Anything to clean out the tooth. Because I agree with Trish. Like the most important thing for bonding is having a super clean tooth. So I use the air polisher sometimes or the micro etcher, either one. Um, I use the Ultra Seal, Ultra Dent Hydro Seal because it's a wet bond. I started years ago. I used the Embrace. I don't know if you guys heard of that. That's like also a
Hmm.
wet bond. So I kind of got used to it, and to me it works really well. The Ultra Dent I think is a little bit better. Um, yeah, so I basically clean the tooth really well, isolate, I etch of course, chalky, and I use a brush to really work in the sealant. I think that helps a lot too. I
Yeah.
really work that sealant into the grooves a lot.
I do too.
Then I cure it, of course, and all my retention has been really, really good. Uh, I've used ClinPro too. It's a good sealant, but I think that wet bond is really, really nice. The ClinPro is nice too in a way because it's an unfilled resin, so it's very thin. So it's kind of watery, so you can get it really into the grooves really well, and it's gonna like just wear down naturally. So you don't really have to adjust the bite on those. Whereas the Ultra Dent, I mean, I put it on really, really thin anyway, so I don't really worry about the bite. But I know some people put it on too thick sometimes, and it has an effect on the bite. But that ClinPro, because it's unfilled, um, it'll just naturally wear down to the natural occlusion over time, and you'll have like the seal inside the grooves. Um, yeah, so that's my method, and it definitely works. And like I said, the retention has been really good, especially with the Ultra Dent sealant. So I definitely recommend it. If you guys haven't tried it. Yeah.
We just had sort of a wake-up call at my job. I always thought it was kind of an old wives' tale to see decay under sealants. I just never seen it clinically
Hmm.
until just last month. One of the dentists I worked with had a sealant placed by another dentist, her private dentist, and about 4 months ago, and 4 months later she had a huge occlusive caries under it, and I explored it myself, and there was a chip at the sealant towards the distal on. It was on two, and first cavity of her life, it wrecked her
Yeah.
life.
Yeah.
But it was like, wow, that really cemented it. This actually can happen, and that placement is so critical.
Hmm. Yeah, I think the debate is more on placing it well or not placing it at all.
Yeah.
Because we have, hygienists can place sealants now in the public health settings, have their own business here in this state. So I see a lot of sealants come through. Like we see the patients for their 6-month recall. They might have seen a hygienist or somewhere else, and they got sealants in a school program or whatever. And I hate to say it, but I would say at least 80% are just awful. Like they're not placed well at all. Some of the sealant's not present. It's really thick. It's got a really poor margin, like leaky. So I think the controversy. Oh, there goes Andrew. He'll come back. So I think that's most areas. Lost you for a second, Andrew.
Sorry.
All right. So I think it's mostly about placing it well. I do agree. If you don't place it well, don't place it at all because you're going to create that trap.
Hmm.
So you guys think?
I've done public health sealants before, and looking back on it, what we were doing is that was the first time I ever used Bond because it was kind of my Hail Mary pass of, well, I don't have my other equipment to really make sure that this tooth is clean underneath, and I sure hope nobody finds sealants bombs in 2 years under these guys. So I didn't get to follow up on those children, but yeah, it's I think that not having the right equipment in a public health setting can be an issue of, yeah, I mean, maybe a sealant isn't the best option if you can't do it properly.
Mhm. Yeah, I often hear on Dental Town, of course, when they mention these things. I hate when they say, hygienists or assistants shouldn't be placing sealants. But what they really mean is some teeth require a little bit of prep. I mean, that's all they're really saying, you know. So, because we can't prep a tooth at all legally, then some teeth need that. So, but the way they say it is like, oh, hygienists don't have the skill. It's like, no, we have the skill. It's just we can't open up the grooves if needed. Uh,
So I think, for me, as far as sealant placing, if there's a lot of staining and things like that, I actually prefer the doctor go in and do like a little physiotomy or do something like that, just for me personally. I'm probably also a little bit more conservative when it comes to placing sealants or wanting to place sealants. So, for example, my own children, I don't want them to have any sealants, only because I see them daily at home. I can look in their mouth whenever I want to. I can really stay on top of it. Once I start to see if they're starting to get some staining, or maybe there's legitimately grooves that can't be accessed by
Right.
any sort of brush, and those ones need to be taken care of. But adults, depends on their home care. I'm not, just because there's a little bit of stain there, I'm not necessarily going to want to open it up and put a sealant in there, or even a small little occlusal composite or anything. I'm a little more conservative when it comes to sealants, though, just for exactly what Daniel was saying, is the chance of recurrent decay. And even with me, I think I'm fantastic at putting sealants in. I might screw up, and I don't want to do that to my own children or someone that's actually healthy and create a problem when there's not already a problem.
Mm.
That's interesting, though. Both of my kids inherited my buccal pit fissures that are awful. So yeah, they've got their sealants in at least on the sides of their teeth. I made sure that those were like sealed as soon as that little flap of skin was out of the way. It's like, oh, is it there yet? It was like, here, I'm taking you in after hours. We're going to get those sealed because I have the little snake eyes on the sides of my teeth. Yeah.
That's the advantage, too, of micro-etching, which I do sometimes. If the patient does have staining and I micro-etch, a lot of times I can get rid of that stain.
Yeah.
But, because the air polisher is, sodium bicarbonate is not as it's not as abrasive as the micro-etcher. So, but it works. If you get it off. I use it at low pressure. I don't use it if you go up like 80 psi or higher, now you're talking air abrasion, which we can't do legally. I'm at about probably 30 psi, 40 maybe the most. So it's nice to clean the tooth. It really works well. Doesn't get all stained. Like some stain does require actual prep, but in that case, then I'll punt it. But in most cases, it'll get it, and then most cases they don't have stains, so it doesn't matter. But I'm a fan of sealants, but I understand the issue. I think too many people, including dentists too, they don't take the time to place them well. They just see sealants as this. Oh, it takes 5 minutes. It takes 10 minutes. Like, I don't think so. Not me.
Mm-hmm.
Yeah, it takes me some time to do it. But I see a lot of kids, so I do a lot of sealants. So a lot of kids move around a lot. After a while, they get used to stuffing the isolate in their mouth.
I found I have a way easier time when I use the isolate on kids versus adults. The adults hate it.
Yeah. Yeah, kids can take it a lot more.
Yeah.
You gotta sell it to the adults though, like almost like present it as a non-choice. And if they push back, then you're like, okay, all right, relax.
And calling it Mr. Fishy doesn't work.
Yeah. Yeah. I had a lady one time. She was kind of a pain in the ass patient. I used to use isolate all the time when I use the couch on every patient. But now if there's like say I have an easy prophy, I don't bust out the isolate. But before I used to use it on like 90% of the patients with a Cavitron. So this lady came in. She was a pain in the ass lady. Typical, you can picture her. And I pull out the isolate. I'm explaining what it is. She goes, "Oh hell no," And I was having like a bad day already. I was like busy and it was crazy, and I was like, all right, because people like that, I just go. I mean, she's been a bad patient ever since. Like she's just not, But she likes me. That's the problem. She loves me. Oh, that's my hygienist. That's my guy. And I'll think in my head, I don't like you at all. But yeah. So she was like, hell no. So I was like, I had a bad day. I was like, okay. So she saw my face, and I was in my head. I'm thinking, okay, it's gonna be a crappy prophy today. Because like the more they're a pain in the ass, the more I'm not gonna kill myself to give you a perfect prophy if you're gonna be like that, But she saw my face and she's like, "Oh man," and she goes, "You gonna hurt me now?" I'm like, "No, I'm not gonna hurt you. Relax." Anyways, yeah. So that's It takes a little practice to present it to the adults, especially. And Daniel's correct there, because the kids tend to take it a lot easier than the adults. It seems
Yeah.
like. Any more thoughts on sealants? Are we all kind of pro sealants for the most part, I guess? But,
Yeah.
all right.